Good afternoon. My name is Brenda Albert, Kenai Peninsula Borough Information Officer. And tonight we're here again to provide you an update and to help address any questions that you may have. Want to remind folks that if we are not able to answer your questions that are specific to agencies, we'll do our best to try to get you the answers, or perhaps those agencies can pop in and address those questions for you. And with me tonight is Dan Nelson, our incident commander. Good evening, Dan.
Good evening. Evening, everybody. Welcome to our kind of nightly update, and we're so glad you're here with us. I've just got a brief update for the day, and we'll get into some questions. It was a fairly good day. We had some time for a lot of our staff and a lot of the response personnel that have been working on this for the last 2 weeks to kind of take a rest. So we were able to give a lot of folks some days off, but the crew that remained was welcoming and onboarding some of our new folks that we have coming in and providing them some awareness and briefings so they can start getting into part of the team. And we've got some operational folks joining us with many, many years of experience that we're glad to have with us and just getting them set up and on board. That was your borough's EOC, your Emergency Operations Center, and that team here today. It was really focused on that and getting into some good discussions and long range goals. For the most part, our cities and our healthcare facilities, hospitals, and the borough are all continuing. We meet each day on a call to discuss items and continue planning, and really things are going very well. There's everybody's just kind of in that mode now, as I'm sure that you feel, where we're kind of just in this, and we're in this for the long haul. So we've been really focusing on transitioning to what we're calling the marathon. We're in it for the long haul, and we need to make sure that we're able to keep our capability up, to respond, to be able to keep people safe, to be able to keep our operations running for the long term. That was really today's focus. We do have a quick update on cases for you for the Kenai Peninsula. There were 2 additional cases confirmed positive today. One of those was in the Soldotna area, and one of those was in the Homer area. That is our update from our Department of Health and Social Services today. They were able to get us that information. Really, that about sums it up. But we'll definitely get to some questions. But that's your update today from your borough incident management team.
Dan, thank you for that. Just a point of clarification. I know that the City of Homer, as well as South Peninsula Hospital and many other agencies, are collaborating and functioning under a unified command system. And they released information on the Homer case that is on our blog. And as far as the other cases, or even on a go forward basis, why are we not addressing specific information regarding that individual?
So that has to do with a couple different reasons, but mainly the privacy of the individual and to respect the protocol that's in place from the state. So I want to remind people that the state health and social services are public health folks. So if you tuned in last night, Leslie Phelps was our guest on this program, and she shared some of the information that they look at from the public health realm. But she also touched on the fact that they do a significant investigation and trying to backtracking with contacts and other things from a health and medical standpoint. So as far as the borough is concerned, we will let you know if there are changes in that case count, and we'll let the medical providers and the agencies handle that. We'll let the families and the patients deal with those things, and of course keep them in mind in our thoughts. But that's the end of our role, and we're respecting people's privacy, and we'll keep you up to date on things that definitely are needed to be. But as far as the individual details, we'll be letting people have their privacy and work through that with their healthcare providers.
Always good to remind folks of that as well. I know on the other hand, we have our communities that really want to support and help those individuals, as well as follow the newest mandates. And that's one of the things that we'll be talking about tonight. Before we do that, we're going to take a little bit of a tactical pause and talk about KPB Alert Notification System, something that I think is a good refresher, as well as perhaps an explanation of what happened last night. And I'll hand it to you, Dan.
Thank you. So let's talk a little bit about what that system is, and you may remember that here about a year and a half, 2 years ago, we replaced our alerting notification system with this new KPB alert system. And in addition to the social media pieces that you see, the Facebook feed that we're on right now, the Twitter account, the website, we also have this system that pushes out notifications to phone numbers, and cell phones, and text messages. So that notification system is, real quick, is an opt-in system for your cell phone. So I'm going to take this opportunity right now to remind people, if you haven't signed up for that, if you haven't signed your cell phone up, take a few minutes to sign your phone up right now. And what that is you'll put your cell phone numbers in for you or anybody in your household, and you'll also give us your physical address that the borough issues you, and that will associate your number with a location. That allows us to target notifications if there's emergencies in your area. We've used this system for many, many things, whether that's for large scale events such as tsunami warnings or evacuation notices from coastal areas. We had some of this when we were communicating different stages in our Ready, Set, Go program for the Swan Lake fire and many other fires over the years. It's an important way for us to be able to get information to you quickly, and it supplements our social media presence as well. The reason why you have to opt into it is we don't have access to your phone number from cell phone providers. It's your choice as to whether you wish to receive notifications and how you wish to receive them, if you wish to receive texts or not, and those types of things. So it does require you to take that step, but you need only take that once, and then we'll have your information. So please be sure to register all of the phone numbers for your household, and you can do that online. Visit our website, alerts.kpb.us, or you can go to our blog, kpboem.com. You'll see a link on there with that information. So with that, that'll give you a little bit of background. That's the borough's warning system that we use in conjunction with many of the federal level warning systems. And so I want to talk a little bit about what happened last night. So the governor's mandates came out, and as we discussed on our panel, following those mandates and really taking those to heart is essential. And we've been talking about how the borough doesn't have the authority to put out mandates like that, but now that the governor has done it, it was an important enough message that we wanted to get that out to people who are not watching these broadcasts, who maybe are not on social media or not visiting our website. So we sent out a voice message and a text message to remind people of that. There was some confusion with those messages. So there were essentially two errors that I want to address. So the first one, when we send out text messages, our system is limited. We don't have the ability, as many phones do, to have a long text message or basically multiple text messages. So we can only send out 160 characters. So the text message that went out to fit into that window was very compressed and didn't talk about any of the exemptions or the ability to take care of critical personal errands as the mandate talked about, which caused some confusion. The voice message, which is a voice-to-speech system, did talk about some of those things, but it inadvertently said that the mandates were effective May 28th at 8 a.m. instead of March 28th at 8 a.m. this morning. So those two errors caused quite a bit of confusion. So to mitigate that, what we try to do is fix that. So we sent out a follow-up text to explain a little bit more and gave a link to our website. And we stopped the telephone call-out system. So many of you, you may not have received a phone call even if you were signed up, because we stopped it during that process. The reason why we didn't restart the phone is it was getting fairly late in the day. It was getting to be about 8:30. It takes some time. So when we do that many call outs for the entire Kenai Peninsula Borough, it has a tremendous effect on our phone and internet systems, that bandwidth. So we slow that down so we're not impacting any one community or any one neighborhood phone system by sending out that volume of calls. So with it being slowed down to that effect, it simply would have been too late at night. We might have been getting into waking people up and those types of things. So that's why you may not have received a phone call. So that's a real brief recap on what happened yesterday. It's a great system. I certainly apologize to everybody for the errors, and we felt it was important enough to get that message out, but a little bit of some mistakes in execution.
That is good for folks to understand. We had several questions about that, and so I appreciate the fact that you've taken the time to explain that in detail for people, and hopefully they will also be able to share that with their friends and family, loved ones that were not able to get on tonight's broadcast or may not have social media. Let's talk a little bit about these two mandates that were released yesterday. They are now both effective as of today based on the different timestamps. Mandate 11 is about social distancing, whereas Mandate 12 is about intrastate travel. There's been a lot of questions about both of them, predominantly starting with the question, if I do this, can I do that? So with that, I'm going to punt to you and let's talk a little bit about what that means to the individuals that are reading both of those mandates.
Of course. So just to recap, is essentially those mandates talk about two different things. So when we talk about social distancing, there's a mandate for us essentially to remain in our homes. If we are going out for certain activities that I'll get to in a minute, we still must maintain that social distancing of at least 6 feet away from others that are not in our family. The other mandate prohibits intrastate travel, essentially travel between communities, except for certain reasons. So those reasons are fairly long and comprehensive list. I think the list of exemptions or critical infrastructure, those types of things are about 3 pages long. But let me try and just sum up a little bit about what those say. And I'm going to direct you to our website that has the full text of these linked together. Essentially, if you work in a critical business or critical industry, that includes things like healthcare, first responders, those types of things. But it also does include certain businesses, such as some construction businesses, people who are working at grocers or pharmacies, people that are working at restaurants and food service, as long as they're complying with the previous mandates prohibiting dine-in service. So it's an important step to realize that still a lot of our economy and a lot of our way of life is dependent on the individuals that work in these sectors. And take a minute, please, to thank those folks that that maybe work for the utilities or the phone company or the grocery store, those people that are trying to make your life better during this time. So that second mandate, or I'm sorry, so the second piece of that mandate is what is called critical personal business. And that includes things like going grocery shopping. Again, encouraging us to limit our trips as much as possible, not going often, not taking our family, provisioning health care for us or for our family members, child care type things, custody arrangements. So there's a long definition of what those critical personal needs are. So if we're doing this for work, and if we're listed in one of those sectors, or for critical personal needs, we are still allowed to leave our home, maintaining social distance to be able to travel between communities. So that's a very, very brief overview of what these mandates say. In essence, stay home. As we've been talking about, unless you have work, and even if you are in one of those sectors, we're going to encourage you to stay home as much as possible to help flatten that curve and prevent the spread. So when we get questions though on, can we do this, or what about this, what about that, each type of scenario, that's not something that we can really answer. The borough didn't write those mandates. It came from the governor's office. I encourage everybody to look at the text, look at the frequently asked questions. All those things are linked, and then you can make your own decision on whether your personal situation or your business or errands falls into those categories that have been established.
I'll give some examples today that I want to celebrate. Some folks who took the time to talk to me about how they still got outside to recreate, get some sunshine, and to still quasi socialize. A couple of friends who met on the lake and snowshoed on opposite sides of the lake and made games out of being able to yell across the lake and visit. So there is definitely ways that you can still get out and enjoy the outdoors, still be that 6 foot distance apart from each other or farther across a lake, and enjoy what Alaska has to bring, but also being mindful of how important it is to follow these mandates so that we can stop the spread or slow the spread of this disease that can certainly impact our healthcare system, can certainly cause some dangers to individuals that have compromised immune systems. All of us have heard it. We've heard it now for several weeks, but we're Alaskans. We do the right thing. We rally together when we have to, and we certainly know how we have to get through this together based on the information we've received. Some of the other things that have also been included in these mandates as questions are, if we are a business that has to travel to another community to get supplies, is that allowed? You did bring that up about businesses being able to still conduct limited types of business. Would that be allowed to get supplies, for example?
You know, and again, if we look at those mandates, I'm going to encourage that person asking the question, if their business is part of that infrastructure, if it's open, you know, chances are that you know, you might be able to interpret that as being able to do that business. And you know, what I would ask any business owner or anybody that does have to go get supplies or grocery shop is think about the ways that we can do that now that don't require the physical distancing, or I'm sorry, that do allow the physical distancing, that don't require necessarily that time out of doors. You know, so when we talk about supplies, you know, can they be shipped or delivered? For those of us, you know, for our own personal homes, does there pickup services or some of those other things that doesn't allow us to go in the store? So I think one of the take-home messages that we really have to take from the governor putting out these mandates that are very significant. And probably, you know, I don't know if this has happened in the history of statehood, certainly not in my memory, but these serious mandates are being put out for a serious reason. And so let's look and take advantage of the technology and the services that are out there and deliveries and those things, and look at all those ways we can potentially stop from going out and having that physical contact.
Another question that came up with regards to Mandate 12 several times was traveling either by road or air that is not allowed from community to community. Is that correct?
Correct. If there are the exemptions for that critical business and critical personal errands again, but you know, that's something that you want to check, especially, you know, if you're talking about some of our smaller communities. So I'll give an example from the Kenai Peninsula here is that some of our villages, such as Nadwalek, Port Graham, Tyonek, they have closed their villages to air travel. They've forbidden visitors. So if you are doing that type of commerce or doing those types of business, you're going to want to double check on that. But pretty much, if you don't have a work reason or a critical personal need, the mandate, it says that is forbidden.
Very good. I'm going to take a couple minutes here to look through well, not a couple minutes, but just a couple seconds here to look through the comments to see if there's anything overall that we are missing that we want to make sure that we share with folks. One of the questions that came up earlier in another one of our threads was with regards to, should folks that are asymptomatic or maybe asymptomatic and they are in the public, should they be wearing a cloth mask when they're out in the public?
So right now, CDC guidance tells us that if you are not showing symptoms, they are not encouraging people to wear masks, and that answer is based on the needs for some of these masks and other personal protective equipment that may be required for medical professionals. So I will couch that answer into saying that that's definitely talking about, we hear a lot about the N95 masks, the surgical masks, and those types of things. When we're talking about the cloth mask, I'm going to make an assumption here that that might be some of the masks we've seen different people making. I can't address the medical science behind that, if that is beneficial. But that is something that certainly is a choice. But I do really want to drive home that if you are buying commercial masks or some of these things that would be used for the personal protective equipment for medical professionals and first responders, CDC is asking us to not do that and to allow those masks to go for our first responders. So I can't speak about the science if you're not symptomatic, but um, that is what the CDC guidance recommends right now.
Speaking of masks and homemade masks, the Central Peninsula Hospital had a call out for homemade masks, but also about protective, personal protective equipment. Can you expound a little bit about that? Bring some clarification so that they're not inundated with the wrong kind of things that they're asking for?
Certainly, and I believe that they have a website set up for our releases that I'm sure that we have on our website that will talk about exactly what personal protective equipment. But when we talk about things, and let's stick on the mask theme for a second, is what our medical providers are looking for when they put these calls out is generally commercial masks, commercial products that are not homemade, those types of things, those professional grade things that can supplement their inventories during a time where everybody is having difficulty getting personal protective equipment. So they may also be using some of those homemade masks and things in reserve, but they're primarily looking for those packaged, sterile personal protective equipment. And I don't have their announcement in front of me, Brenda. I don't know if they're identifying anything else specifically except N95 masks. Do you have that handy?
I do, and actually you're spot on. If you'll go to our blog, we have the link on the right-hand side. So it'll be this side for you guys. Scroll down, and it is Central Peninsula Hospital COVID-19, and they have a dedicated page. It also has what they're looking for specifically, and we want to make sure that we follow those requests so that they can categorize and of course, create an inventory that will work for their needs. So again, go to our blog, kpboem.com. On the right-hand column, you'll see the hospital's page and the link for those requests. Okay.
And speaking of our blog, if I could jump in on just that comment. So when you visit and are linked to those pages, and you may have joined us here a few nights ago, we did a bit of a tour, but I wanted to point out that on the left-hand side, I believe it's the left-hand side, will see some contact phone numbers. And I want to remind people of the availability of the 211 service. By dialing 211 on your phone, and also linked on our blog is the 800 number. And I believe that's 800-478-2221. Brenda, can
Correct.
you confirm that? Excellent.
You are correct.
I had some memory there, but that's on our blog. And that is a phone number for general questions regarding COVID-19. It is staffed by operators, a lot of volunteers that are really available to take some of your questions. And especially when we talk about things like these new health mandates and some of that, we provide that material for you, but general information about COVID and some of these things that are coming out from the state level are available from those folks. So I know they're staffing that, I think, during some daytime hours, and they're getting a lot of calls. So we'll certainly ask for some patience with that as a resource as well for folks to address. So visit our blog and you'll see a link to that.
One of the other questions that's come up, and in this thread, there's several times with regards to reporting individuals that are not following the mandates. Can we talk a little bit about education versus arrest as it applies to these mandates?
Of course. So we'll start off just by the legalese that, the mandates do come from the state. There are laws that can enforce them. So but the police agencies, both at the state and local level, have really been focusing on education and trying to educate as to why they're important, what steps we can take, those types of things. I don't believe it's in anybody's interest as far as law enforcement officers or police agencies to be arresting people to be in violation of this. Remember that these mandates are out there. Really as guidance, and more than guidance, that's the wrong word, but are encouraging us as Alaskans to do the right thing. And they're really not much different than the things that we've been talking about for the last 2 weeks since we've stood up. So we're focused on education, focused on prevention. We don't want our law enforcement first responders to be dealing with these things when they have other things to deal with, but they are out there and they can be enforced. If you're seeing something that you believe is not pursuant to the mandate, an individual doing something, or something happening where you think that's not correct, the state has set up an email address to take your reports and to follow up with that. And that address is investigations@alaska.gov. And I'll give that one more time for folks. It's also in the text of the frequently asked questions for this mandate, but the email is investigations@alaska.gov. And that's a place where you can send your reports or questions if you think that something is not complying with that mandate.
We've had a few folks in the thread who are asking for confirmation of total counts in the state. In our blog, also at the top right header, or top of the column, is the covidvirus.alaska.gov website. It is truly a repository of information as it relates to Department of Health and Social Services information statewide. It's also broken down by jurisdictions, municipalities, boroughs, and you can look at cases both statewide and individual numbers. That is updated in the afternoon. For example, the cases that are on today may be updated later in the evening. It's not going to be instant. We've had a few folks wanting to know, why is it not there right now? And the importance of being accurate, making sure that we're confirming with our healthcare officials before any information goes on the stat page is important. So please be patient if the number may be skewed as it relates to a media release, but they are going to make sure it's updated at the appropriate time. Again, that's covidvirus.alaska.gov, and the count on the page right now is at 102. That's 102. Do you have anything else to add with regards to the stats and as it relates to our borough, Dan?
Nothing too much to add. We do keep an eye on those statistics. We do update on our resources, and I'll also point out in the right-hand side is our mapping display and our hub, which does take some of the data from that page as well. So if you haven't checked that out, that I think is near the top of the right column as well. We talked about it a few days ago. It also gives some other information and statistical information for our communities of interest as it relates to demographics and other things. It has a map on the status of borough facilities. It's got some great information that we keep working on. So if you haven't checked that out, it's a great product. Our GIS, which is our mapping folks, Geographic Information Systems, did a great job on that. So please go ahead and check that out if you can.
And with that, I'm going to go ahead and offer a few closing words that I would like to share with folks, that in the event you feel like you're coming across these mandates and still wondering what else does it mean as it relates to B. Bottom line is, you make the right decision. Let's support our communities and let's stop this spread. Let's get through this together so we can be even that much more stronger and resilient as Alaskans. And with that, I'm going to ask you for some closing words, Dan.
Again, everybody, thanks so much for joining us. And really, it can't be said better than that. As we are Alaskans, we're residents of the Kenai Peninsula. We come together when our neighbors are in need. And this is a time where we are, focusing on each other. We're focusing on ourselves, keeping ourselves healthy, and also ourselves and our families. So, what I really want to tell folks, it seems a little bit hokey, but we're here for you. And the reason I say this is this is a great time for me to give recognition to some folks that you don't probably know who they are. I talk about this thing. It's called an incident management team, and I talk about an emergency operations center, and really, let me take a second and explain that these are folks, mostly they're folks that work for the borough in many positions. Both in my office, I have a few staff, but there's also people that work with day jobs in many different services that are provided. They take extra time, they train throughout the year. They've taken on these extra responsibilities. There is no extra pay, but they do it to serve in times of crisis. And I'm the one that's up here, and I'm the one that kind of talks to you and talk about things. I tend to take the flack for things when there's mistakes, which is my job, and I tend to get the credit for things when things go well. And really, the issue is that when things go well, it's these folks that I have behind me. I can't name them all. We've got a great group of people. We've got some more coming in, but I want to take just a moment and thank everybody that works for me, that has come and volunteered for me, and those folks that have called me from the community and volunteered facilities. They've volunteered their time. We're looking into ways as we look at flattening the curve and some of our social distancing things. It's a little bit hard to do some of that right now. But as we move towards recovery, then we're probably going to need some help. And our community, I'm confident, is going to come together. So with that, from the bottom of my heart, thank you, incident management team, and all the folks that volunteer to help me and definitely have my back. That includes Brenda. Thanks so much for facilitating all of our public information needs. And once again, thanks to our community members. This is a tough time. Not gonna lie, it's a tough time. So we appreciate you. We appreciate your patience and understanding. We'll be here tomorrow, 7 o'clock. Please ask us questions in the Facebook thread. We'll be happy to address them. So with that, I'll wish all of you, hope you had a great Saturday, a very great rest of your weekend. We'll see you tomorrow night.